So let's take a look at tooth anatomy. Here we see a plastic arch of teeth, and the labial portion of the tooth on anterior teeth is the portion facing the lips. And I'm pointing to the labial on the anterior teeth. The occlusal would be a posterior tooth designation, and that's the biting surface. Here the premolar on the maxillary or upper arch. Here's a premolar on the lower arch. That would be the occlusal or biting surface. And molars have occlusal surfaces as well. That same biting surface on an anterior tooth is referred to as the incisal. So that would be the canine, the lateral, or the central incisor, both the maxillary arch, the upper, or the mandibular arch, the lower. So that's the incisal. Occlusal posterior teeth, incisal anterior teeth. Now the gingival, toward the gingiva or the gums. That would be the same whether it's on the front, the back, or the side of the tooth. And it's the same on the maxillary arch or the mandibular arch, the lower teeth. So that's the gingival. Now the distal is the portion of the tooth that's away from the midline. So here's the distal of the lateral incisor. The lingual would be the inside or the tongue side, lingual referring to toward the tongue. So here's the lingual of the lateral incisor, and the same thing on the lower arch. The gingival on the lingual is the same as it is on the facial. And here's the incisal view looking up on the upper teeth. This would be the mesial toward the midline. That's the mesial toward the midline. That's the mesial on a lateral. The mesial, the mesial, the mesial. So that's toward that midline. On a posterior tooth, same thing. There's a mesial. Now the distal on the canine. Away from the midline is the distal. So it's like north, south, east, west. On posterior teeth, the front surface is the buccal. Here the model is inverted, so that's the buccal. Let's take a look at some supplemental terminology too. When we talk about the long axis of the tooth, we're talking about the axial. That may refer to mesial, distal, buccal, or lingual. And when we talk about axial reduction, for example, in tooth preparation, we're talking about reducing tooth structure in the long axis. There's another term, interproximal, and that's in between the teeth. So that could be either mesial or distal. So interproximal just means it's the area between the teeth. This would be the interproximal, even though it's also the distal. So sometimes those terms will be used interchangeably if they're not trying to distinguish which specific tooth it is. Let's take a look now at a clinical example of a full crown so you can actually see these surfaces as we're preparing the tooth. Instrument design is specific for tooth anatomy. So here is a football-shaped diamond for starting the occlusal reduction, occlusal, the biting surface. And it's kind of a gross reduction. We need to remove it in fairly quickly. This tooth has a fracture. So you can see we've started the axial reduction on the distal of this tooth. That's the far side away. And now we're doing the interproximal on the mesial aspect of the tooth. And this is called a bullet-shaped diamond. It's a fine diamond that's round-ended or bullet-shaped. Might be called a round-ended more appropriately. And we're doing axial reduction. Here's the buccal. It's still axial reduction. And we're creating a chamfer finish line. And this patient has a rubber dam on and a rubber dam clamp. That's why you don't really see the gums. It looks green down there because it's a sheet of latex rubber to protect the areas while we're doing the preparation.